Hi, everybody. My name is Adriana, and today I'm going to be sharing with you my vlog activity about modifications for exercise. I'm going to be focusing on seated exercises with those who are wheelchair bound. I had the privilege of working with a cerebral palsy patient at Court Physical Therapy, and these are where I learned these exercises, and I learned just as how important it is to strengthen those muscles, even though that we are bound to a wheelchair, and improve our quality of life. And all these exercises can be performed standing, and they are activating the same muscles as they are seated. So it is important that we express that to the patient as well, because they think they're at a disadvantage, but in reality, they are just as important as we are. So I'm going to go ahead and I'm going to be seated in my computer chair to showcase how you would perform them. So I'm going to scoot my chair back. All right. So to start, I like to start with the ankles up. I think that is a great warm up and a great sequence of events, just because as we go up the legs, it tends to get a little bit harder and a little bit more tired. And keep in mind, since they are wheelchair bound, they are bound to having muscle spasms, or things might be a little bit more difficult than they actually seem. For my patient, we couldn't go more than 20 times, and we couldn't go more than 30 seconds if you were having a timer. And we also could not go more than a 4-pound ankle weight. And I will demonstrate that when we get there. So the first thing that I like to do is I like to do toe raises. So I like to have our feet together if you could, and lift our toes up to the sky. I think this is really important for our range of motion in our ankles, just because they are seated and they don't get that gait that we usually get with walking. So therefore they have to do the exercises to improve gait. And same thing with the heels. Now we're strengthening the calf muscles. And these can be performed standing off of a bench, block, anything that you would like in a safely manner. So moving up from the ankles to the quads, the one thing I like to do is I like to do knee extension kickouts. So I like to kick out and back. And like I said, with my cerebral palsy patient, we could only go up to a 4-pound ankle weight. So therefore I would put the ankle weight around his ankles, and I would have him do about 2 sets of 10 on each side. And after that, he got pretty tired. He's not prone to having any muscle spasms in the lower half of his body, just the upper half, but that's for a different video. So after the ankle kickouts, one thing I like to focus on is the hips. So if you have a ball, I like to squeeze the ball. These are called hip adduction squeezes. They strengthen, just as they sound, the adductor muscles in your hips. And then once you do about 20 of those, you're going to put manual resistance on the outside of their leg, and you're going to pull apart. These are called hip abduction. So therefore, you're giving manual resistance against your hands. And they have to pull their legs apart. Or you can have a band around their legs as well, and that does the same thing. Now moving up to the hips and the upper hips and the core. Even though they are seated, I think it's just as important to strengthen our core as well. So I like them to have, if they're able to sit up as straight as possible and to engage their core and to lift up their knees like a march. This is strengthening the hip flexors as well as the core muscles and all of the other muscles in our body in the lower half, because they have to keep a stable core to lift up their leg. So I think this is a really important one, and my patients seem to really like them as well because it imitated the simulation of walking. So those are some exercises that you may see when it comes to seated position exercises in a wheelchair. And like I said, it is solely based on the patient. If the patient can't tolerate it, then you need to reduce time or reduce reps, and just make sure that their voice is being heard, because most of the time they think they're at the disadvantage, but in reality, we care about them just as much as they care about us. So I hope you learned something from this and you can take this with you in your future careers, and I hope you have a great rest of your day.